What if your sheriff was a therapist? My campaign for Winnebago County Sheriff is fundamentally recentering the conversation on what it means to lead a modern law enforcement agency. By prioritizing 15 years of clinical and administrative expertise in mental health over a traditional badge and gun background, it's a bold shift, and it forces us to ask whether the complex challenges of 21st century policing, which involve addressing rising mental health crises, domestic violence, increased distrust in law enforcement, and departmental burnout, these issues require a command staff that understands the neurobiology of trauma just as well as they understand the criminal code. De-escalation isn't about being soft. It's about being effective. I'm coming at this with a background as a licensed professional counselor. Having worked in county human services, rehabilitation facilities, doing juvenile sex offense treatment, and hospital systems, I'm trained in trauma-informed care and de-escalation. These aren't skills that taught me how to approach things necessarily with just tact and empathy, but it's also what taught me how to be effective in an unwell system. 2026 Scoping Review published in Psychology, Crime and Law highlights that trauma-informed policing is a system-wide strategy that promotes a shared understanding of trauma's effects to minimize ongoing traumatization. When we look at Winnebago County, we have to consider if this specific toolkit is actually the missing piece for community safety. A sheriff isn't a patrol officer. Does the conventional wisdom say that a sheriff needs to have spent decades in a squad car or walking the beat? Because from my perspective, when you look at what a sheriff actually does, it's a high-level executive and administrative role. It's about judgment and ethics and vision. My past 15 years in the clinical world, particularly that at the administrative level, means that I've been managing complex systems with diverse staff, high-stakes crisis situations for my entire career. The current research notes that, like many interactions with law enforcement, involve people affected by trauma, survivors, witnesses, and even suspects. If the person at the very top of the system doesn't understand the intersection between trauma and behavior, the entire department's response is going to be skewed. My advantage is that I don't have to be trained on the why of human behavior. I already possess that expertise. I've spent a decade and a half navigating every county system that the sheriff's office interacts with daily, and I have critiques. Who wouldn't know how to operate that system better than a person who's been on the receiving end of it? Authority doesn't come from having used force. There's this persistent concern, which is often rooted, let's be so for real, in traditional patriarchal views of law enforcement. A candidate without a hard policing background can't maintain order. It's a little gendered and outdated, isn't it? The idea that authority only comes from having used force rather than having the wisdom to prevent it. My training in de-escalation and trauma-informed care is actually a tactical advantage for the deputies themselves. Police officers are often required to respond to trauma across multiple domains. This constant exposure leads to high levels of organizational stress and post-traumatic stress disorder in officers. Something that took me at least the first 5 years of my career learning how to navigate as a frontline mental health provider and administrator. A leader like me who understands the clinical signs of burnout and secondary trauma is arguably better equipped to protect the mental health of my staff than someone who views those issues through a purely tough it out lens. A trauma-informed approach actually makes a deputy's job safer on the ground. Researchers are discussing how officers often misinterpret trauma-related behaviors, like a victim appearing uncooperative or a suspect reacting with a shame-driven rage because they feel trapped. Traditional policing might actually escalate those situations, leading to a use of force incident that endangers both the officer and the citizens. A trauma-informed leader like me promotes strategies that prioritize empathy and transparency, which actually builds trust. There's better cooperation. Most reviews point out that in sexual assault cases, for instance, trauma-informed care training leads to more accurate victim statements, withdrawing from the and fewer people withdrawing from the process. If you apply that logic to the whole department, you're looking at higher clearance rates, fewer repeat calls for service, better interactions with the district attorney. It's a shift from reactive control to proactive resolution. Police misconduct starts with moral injury, and here's how we fix it. This leads directly into the issue of accountability and ethics. There's this fascinating point that you read in all the research about moral injury within policing when officers are forced into situations where their actions conflict with their values or they feel unsupported by a rigid hierarchical system, and their mental health suffers and misconduct rates can climb. My background in counseling and ethics is built on a foundation of accountability. In a clinical setting, if you don't follow protocol or if you lose your ethical footing, the consequences for the patient are dire. This is why I carry $6 million worth of insurance per occurrence. When we talk about meeting a bar, my bar is very different than anybody currently in the sheriff's department or ever has been. I bring that same level of professional rigor to the sheriff's office. It's about creating a culture where doing the right thing isn't just a slogan, but built in as part of the organizational DNA. That's trauma-informed care. This isn't just theory. The research shows trauma-informed psychological skills can reduce police misconduct by improving decision-making skills while under stress. Yeah, I got a brain here. When everybody is operating from their amygdala, they're not using their frontal lobe. This is all Dr. Bruce Berry in a nutshell. Every time we see sentinel events occur, it's because they've gone into fight or flight. I understand what is happening at a macro and a micro organizational level. She's never worn a badge. That's exactly the point. I want to address the lack of experience argument head on. A sheriff isn't typically the one responding to a 911 call or a burglary in process. They're the ones managing a multi-million-dollar budget, setting policy for the jail and coordinating with other county agencies. If the Republican Party candidate is using AI to draft the entirety of a very simple platform, what does that bode for the county? Here's the thing. I've been in the rooms for 15 years. I understand the revolving door of the county jail because I've worked with the people inside of it. I know that many of the individuals in custody have high scores of adverse childhood experiences, ACEs. The research confirms that a higher number of ACEs correlates with increased risk of criminal behavior. Instead of just managing the symptoms of that trauma through incarceration, I have the vision to implement programs that address the root causes. That's a very sophisticated level of leadership that traditional law enforcement career does not necessarily provide, nor can be provided by ChatGPT. 98% of officers want this type of support. Most sheriffs overlook it. The research also touches on the benefits of a multi-agency collaboration, like crisis intervention teams that pair police with mental health professionals, not just one that shows up sometimes, but as a system. I'm the ultimate bridge for that. I speak both languages. I can walk into a meeting with a county board or human services department and talk about evidence-based outcomes and trauma-informed supervision. The study mentions that 98% of police officers in some surveys actually expressed a desire for regular organizational supervision and support. That's a massive gap that a traditional sheriff will overlook. But it's something I'm literally licensed to understand. By supporting the deputies' well-being, I reduce burnout, which most studies explicitly link to better community outcomes. If an officer isn't burnt out, they are less likely to misinterpret a victim's response or use unnecessary lethal force. It's not weakness to listen. It's a strategy for safety. It's also about the legacy of the office. Winnebago County, like many places, faces skepticism from marginalized communities. The research notes that systemic racism and historical trauma can lead to a deep mistrust of police and deputies. My approach isn't about ignoring that. It's about acknowledging it through a cultural competency and reconciliatory actions. All evidence suggests that trauma-informed policing must include an understanding of how race and history shape current interactions. A female leader with a background in counseling is often better positioned to break down those patriarchal barriers and build a new kind of legacy that has legitimacy behind it. It's not weakness to listen to the community. It's a strategy for long-term stability. When people feel heard and safe, they're more likely to report crimes and act as witnesses, which makes the whole county safer. What if we treated crime like a public health issue? It feels like we're talking about a move toward public health model of policing. The research highlights this shift from reactive crime control to understanding the underlying structural factors of violence. If I, as sheriff, can look at a spike in domestic violence calls and see through the lens of family dysfunction and trauma, I can allocate resources towards early intervention rather than just making arrests after the damage is already done. The research mentions that collaborative early intervention for young people with ACEs can prevent future offending. My entire career has been about those interventions. I'm not learning these concepts on the fly. I've been practicing them in the field for a decade and a half. What nurses already know that policing desperately needs. One of the most concrete examples the research gives is universal precautions. In the same way medical professionals treat every patient with certain safety standards to prevent the spread of communicable disease, trauma-informed policing suggests treating every interaction as if trauma might be present. This is why they wear gloves, people. This protects the officer from being blindsided by a sudden reaction and protects the citizen from being traumatized further. It requires a very high degree of emotional intelligence, which I have honed through the years of clinical practice. For the skeptics who think this is too academic, the research is pretty clear. Departments that adopt these practices see improved officer performance and better victim satisfaction. That's right. When you call 911, you feel better after the fact because you have trauma-informed policing in place. It's about working smarter, not harder. The county jail is the biggest mental health provider. It shouldn't be a warehouse. So there's this issue of the jail itself, which the sheriff is responsible. The jail is often the largest county mental health provider in any given county, and Winnebago County is quite unique. Having a licensed mental health counselor as sheriff means the jail isn't just a warehouse, it becomes a place where trauma-informed care can actually become the process of stabilization. Trauma-informed practices in the justice system improve the functioning of both staff and consumers or inmates. We use the word consumer. That's what they're doing, right? If we can reduce recidivism or repeat offense by properly addressing the mental health needs of those in custody, we're saving the taxpayers of Winnebago County a profound amount of money in the long run. My administrative experience in hospital systems means that I know how to manage these types of facilities efficiently and ethically. Am I really an outsider, though? They call me an outsider, but I've been in the same trenches. The pushback always comes from this idea of the thin blue line and whether someone from outside can truly lead. Is someone who has worked in the county's human services and rehab systems really an outsider? I've been in just the same trenches with just a different set of tools. Trauma-informed policing requires an integrated top-down and bottom-up approach. It needs a leader who can drive a vision while respecting the operational realities of the deputies. My background in crisis management is key here. In a psychiatric emergency or high-stakes rehab environment, you have to maintain order and safety while de-escalating intense emotions. I have the exact same POSC training, firearms training that these deputies have, but I'm not pulling my firearm as frequently. Women are more likely to use trauma-informed policing. The data is pretty clear. Also, it's worth noting the specific strengths a female candidate brings to this role. While we shouldn't generalize, the research mentioned in most reviews note that some studies found women are more likely to adopt trauma-informed policies than their male counterparts. In a field that has historically been dominated by a very specific type of authority, my candidacy offers a chance to diversify the leadership. This isn't about replacing toughness with kindness. It's about replacing a flat, one-dimensional approach to authority with a multidimensional approach to leadership. My focus on ethics and judgment over raw power is a more sustainable model for the community's trust. The role of sheriff has evolved, and it needs to evolve. Here's what it needs now. What we know is that today, the role of sheriff is no longer about being the top lawman. It's about being the top executive of a complex social safety system. My 15 years of experience in the clinical and administrative sectors of mental health and human services align almost perfectly with the actual challenges facing Winnebago County today. We see that a trauma-informed approach isn't just a luxury, it's evidence-based necessity, of which we can get massive grant funding from many universities who are trying to study this same system, but have no applicable real-world experience to derive that information from outside of computer models. By addressing the root causes of crime, protecting mental health of the deputies, and building genuine community trust, my leadership represents a proactive vision for safety that goes far beyond the traditional model. It's an opportunity to move the department into a future where judgment and ethics are the primary tools for justice, not flock. The national police retention crisis starts at the top. We have to talk about the long-term impact on the deputies themselves. We're seeing a national crisis in police recruitment and retention. Much of that is driven by burnout and the feeling of being unappreciated or ill-equipped for the modern job. A sheriff who prioritizes staff well-being, not as an afterthought, but as a core policy, is going to have a more stable, effective workforce. Most, if not all, evidence points out that organizational climate directly impacts first responder burnout. If I can create a trauma-informed workplace, I'm not just helping the community, I'm saving the careers of the men and women in uniform. I'm giving them the tools to handle the emotional labor of the job so they don't have to take that trauma home with them. A safer community is not one with more arrests. Saying that a safer community has more stability and less trauma. My background provides a unique roadmap to get there. I'm looking to bridge the gap between law enforcement and the vital human services that keep a community healthy. My candidacy is to challenge the status quo, asking if we're ready to value the expertise of a counselor and an administrator as much as we value the experience of a patrol officer. Based on the data, that shift might be exactly what's needed to break the cycle of repeat calls and departmental stress. It's a compelling argument for a new kind of leadership in the sheriff's office for Wisconsin. If this conversation gave you a new perspective on the future of local leadership and the role of trauma-informed care in our community, consider sharing this video with a friend or a neighbor to keep the discussion going. If you're interested in learning more, you can visit my site, daniforsheriff.com. When we talk about grassroots, this is about as grassroots as it gets. Consider donating, purchase merchandise. Hopefully we'll have that up soon, fingers crossed. Any little bit helps. Share these messages and ask questions, right? I want to hear what your thoughts and considerations are, things that you've seen in the community where you know we can do better. I want to step up to that plate for you.